So, and it's very anecdotal. You kind of asked earlier about who gets it.
Yeah.
Who gets scoliosis. And so the typical presentation, we see that young girls tend to get it more than boys, although boys get it too. The general phenotype or morphology of a young person is tall, long, lean, narrow.
Okay.
A lot of them are dancers for the girls. A lot of them are ballerinas or dancers, and they spend a lot of time stretching. So they might be stretching the muscles that maybe we need to not be quite so long, like for instance, hamstrings. And,
always a fascinating phenomenon. People who have excessive hamstring length but still think they're tight need to stretch more. So do you think dancers?
So let me just be clear. It's not that dancers develop scoliosis. It seems like the tall, long, lean young ladies who make great ballerinas.
They're self-selecting. They're basically
right, kind of, yeah.
That's actually, that was the question I was going to ask.
Oh, okay.
Is it because these people just tend to get into ballet because they're built for it, but then they're also kind of built for having less structural support because of how their body is built?
Yeah, it seems to be the case. But I will say there are many patients who don't fit the ballerina stereotype, or kind of ideal body habitus, if you will, either. So I've definitely had some bigger people, or just some kids who don't understand where their body is in space. That is sometimes one of the underlying conditions too, or just that they don't understand how their body works or moves. And then I need to also mention, Neil, that hypermobility. So joint hypermobility is a huge predisposing factor. So we use the Beighton scale, BEIGHTON scale, for those of you who might want to look it up. And it's really just checking specific joints to see, if elbows hyperextend, if knees hyperextend, because that could be a predisposing risk factor. So for example, if you have a young person with maybe a functional curve beginning, and they're pretty hypermobile, and they're starting to do a lot of stretching because of whatever it is that they like to do with their body in their life, those are kind of a couple, 3 main risk factors, so to speak, of potentially developing a structural curve. So we'd want to, make sure we can educate them and start doing some exercises, or just keep their muscles balanced and make sure their hamstrings have strength if they're going to have a lot of length.
Is that where you start? So in terms of, because people will be familiar, if they watch this channel, they'll be familiar with the fact that PRI exists and that there are certain interesting looking exercises that no one really understands. And because of the familiarity of that 90-90 technique with hamstrings, almost everybody a lot of people know what that is at this point in time.
Absolutely.
They don't know where it comes from, but they've probably
Right.
seen it on the internet or on Instagram or something. So
Right.
How do you start working with anybody in terms of scoliosis? What's the first thing that you're trying to do?
So I'm going to back up one quick moment and say, when we start, a lot of times we'll start with educating the people and telling them what not to do.
Okay, go into that, because as a PRI practitioner, I am terrified, not terrified, but I don't know, I don't want to make anything worse, because I'm not aware of all the potential factors that make a normal exercise contraindicated for someone who's scoliotic.
Right. So we talked a little bit about the torsion and the triplanar deviation. So we have sagittal plane issues. They tend to either lose their kyphosis, like the normal amount of kyphosis, and get flat through their thoracic spine. They can get more lordosis and have a very forwardly anteriorly rotated pelvis and a deep lordosis, or sometimes they can have a straight spine from the side view. So they can lose their kyphosis and also lose their lordosis. So sagittal plane is very important. But as I mentioned, with the torsion, that spine is no longer able to kind of bend forward or bend to the side more purely.
Okay.
When they bend forward or bend to the sides, they go into their torsion and their twist and their curve pattern.
Okay.
So because of that, repetitive forward bending, for example, sit-ups or crunches, and repetitive extension through the spine, sagittal plane extension, back bends, gymnastics, lying on your bed, lying on your bed on your belly with your elbows propped up and reading, like propped up on your elbows and getting into extension and hanging out there. Those are things that we want to try to help, especially young people, older people, to understand that those are not the best positions for your body. And a lot of times the young people who I see are like, you mean I don't have to do sit-ups in PE? So at least there's that. At least they have that. And I'll write letters to PE teachers or coaches or whatever if it's necessary to have some medical backing behind it to excuse the kids from that.
Okay, so now that's an interesting, you talked about repetitive forward bending, which is flexion. Now, of course, the vast majority of PRI techniques are putting you into a flexion. So what would be the difference between a PRI technique, which is flexion-based, and forward bends, which people are just saying, oh, bend forward, without
That's a great question.
Understanding of what flexion really is for a scoliotic person?
So we want to really take the time to help these people understand that, spinal flexion is not rib internal rotation. So in PRI, we talk about getting air out, pausing, having a zone of apposition, and then getting air in places where we want to have it better serve us.
Yep.
So we will do spinal protections, spinal precautions. So we teach these young people not only to not do repetitive sit-ups and back bends or back handsprings, but also to be mindful of how they squat down and pick things up off the floor, and how they might put their hair in a ponytail if they have long hair by flipping their head forward and bending over. We do teach a hip hinge, right? And I know sometimes in PRI, a hip hinge is maybe something that we want to stay away from because the idea is you're using extension. But for these young people with a scoliotic spine, they will use their spine instead of their hips. And we definitely need to have them be shifting in and out of each hip equally. So to teach them to have a neutral spine and then have a hip hinge without overdoing extension, with having rib internal rotation in a nice secure ZOA, having them use their hips appropriately so they don't use their spines instead, because it's so much easier for them to use their spines. That's kind of how we...
Why is it easier for them to use their spines?
It's a great question. Because of the hypermobility, because of the deviation, once you get into torsion and twist, the spine wants to go there. And so if they try to do a motion, with their body, it's going to happen in their spine much more readily than it's going to happen in their shifting into each hip.
That's somewhat counterintuitive when you think that the spine is what the problem. Well, I don't want to say the problem is the spine. The problem is the whole thing. But the spine is what we think of as scoliosis. You would think that you would try not to use the spine because the spine is what we're thinking of as the problem. But you're saying that they're going to use that spine because it's just what they're good at doing? It's
the path of least resistance. Okay. That's what their body will, they've compensated and they've had whatever predisposing recipe for scoliosis to develop happen. So that's the way their body is kind of programming itself and hardwiring itself to move.
Okay.
And so it's up to us to try to, we start with myokin or postural respiration, just some basic things to get them to understand that they have hips and they have muscles that are equal that we try to make them equal on both sides, like a left inner thigh or a right glute max, because these young people typically test just like a left AIC, right BC pattern.
Right. So they pretty much need all the same things.
They need all the same things, but there's a few things we have to protect against.
Yes.
And I know Susan's going to get into this a lot more in part 3.
Okay.
Just like she does when we teach AI. So that's kind of just kind of the background,
Okay.
or like a little general introduction. So,
All right. Well, that was good. Can we just talk about real quickly before we finish, bracing?
Sure.
And then, as we said, the attention to casual posture.
Exactly. Yes.
How you carry yourself in space.
Right. So I talk about that all the time with my young people. I use kind of 3 different focus treatments and explain to them that here's your postural restoration and sometimes a Schroth exercise program where, okay, you have to lay down, do this, get this prop. It's a very formal exercise with a handout sheet that they do routinely. That's kind of one category of attack, so to speak, that we have on these spines. The second one is bracing. So a TLSO, thoracolumbo-sacral orthotic, that fits on the body, custom designed, custom made, that is basically kind of hands on you all the time. And so it's holding you and trying to get your brain and your body to sense and feel that you're in a better position. Okay. We could talk about braces a lot, but for the interest of this introductory interview, maybe there'll be room for another brace talk if you feel like your listeners want more details on that. But just to kind of summarize, bracing happens during periods of growth. So we can look at x-rays, we can look at growth plates and determine how open they are. If they still have time to grow, a brace is a great adjunctive therapy to help kind of just hold spines, if not make them better. Our goal is to hold it, because making it better is challenging, but there have been definitely instances of making it better.
Okay, can I ask, a lot of people, and this comes with people who think about eyeglasses, a pair of sneakers that have support rather than minimalist, they tend to get in this idea in their head that they don't want to become reliant upon something. So I could see someone thinking, well, if you put a brace on, aren't you becoming reliant upon the brace? And I don't want to be reliant. I don't want my child to be reliant upon the brace. So can you just address that issue of,
sure,
this is now, but what if the brain just becomes reliant upon that brace? What happens?
It's a great point. And, you know, sometimes when kids need to have their out of brace x-rays, they're told to not use their brace for 24 hours prior to that x-ray so that they can capture the picture of the actual x-ray, the actual spine position, excuse me.
Got it. Yeah.
So because it's understood that when you take off your brace, you may still have a little bit of correction from the brace. And so when they take the x-ray, they want to get it as pure as they can. And some of my kids say, Miss Lisa, I don't want to sleep without my brace or go to school without it when they're used to it. Yeah. Because one little girl said, I feel like I'm going to flop. Like, you're right. They can definitely get kind of dependent on it. Okay. But that's when we interject the exercises, right? We say, that's why you have to take off your brace and do your exercises. And I will say sometimes we do use the brace for exercises. It's rare, but sometimes it happens. But most of the time we want them to be doing their exercises, breathing, expanding, feeling airflow, sensing, moving. If they're an athlete, we want them to do their sport without their brace on. If they're not like a formal organized athlete and they're just a recreational kid who wants to run, jump, and play, like they need a couple hours a day of moving their body so they can sense and feel it and stay strong. But that's a really good point.
I'm wondering how many kids are getting multiple hours of run, jumping, and just play these days.
That's my optimal world I'm thinking of that's in my head.
So keeping them moving. Well, okay, so what if someone's saying, well, my child has scoliosis. Now, isn't it dangerous if they're now moving too much? Aren't they going to get hurt from playing a sport or moving too much? And now maybe they're thinking they need to be more restrained, but in reality, do they need to be more restrained, or do they need to move more?
Well, if they're in a good program and they have a good brace and they're doing exercises, we want them to move their bodies. I mean, they're kids. You're never going to protect a child from moving into right trunk rotation without a strong ZOA. Like, it's just not going to happen, right? They need to explore movement and feel things and sense wind and air and be outside and roll around on the ground and sense and feel, variability of movement is really important for development in so many ways. But we just want to educate, and we talk about pelvic corrections. Like, you can stand and do this activity, but when you stand, why don't you just do this? Like, we'll teach them things to do. So that other treatment focus is attention to casual posture, right? So a kid, like example, I just had a patient yesterday, and it was a teletherapy session because of COVID, and we were talking, and I could just see mom in the boy's face. And there was a young man who I was working with, teenager, and I had a suspicion based on what I could see, and I said to mom, just stand up and show me how he's sitting right now. And he, sure enough, was right in his curve pattern, long on the left, and you could see it kind of tight pulled into to his right side. And so they don't realize that.
Right.
They don't realize it. So that's that other treatment focus of, where's your body in space? Attention to your casual posture. If you catch yourself here, could you maybe just kind of shift and maybe try to feel your left sit bone, or try to feel your left heel, or try to feel a little bit of a different sensation. So it's, just to summarize really quickly, it's those really structured formal exercises, it's bracing, and then it's attention to casual postures.
Which everybody needs to do, not just people. That's
right. I'm here doing it myself. I'm trying to make sure I can feel things.
That is one of the things that's so illuminating to people when you show them how they're standing and they don't realize it. The amount of people who, and this is just in general with PRI when I work with people online, which are definitely not scoliotic population that I know of, I ask them to get into left stance or put more of their weight on their left leg, and you can clearly see that their upper body is still over to the right side, and they don't know it. Until you ask them to pick that right foot up, and then they realize to pick up their right foot, they have to move their weight truly onto their left foot, and they had no clue that they weren't on their left leg. And and they can start to intuitively see that, like, something's amiss here. Like this asymmetry thing is real. Like this behavioral, how I carry my body is a real thing that I wasn't even aware of. And that's a huge aha moment for at least a lot of adults, because that's who I deal with. Does that have the same effect on kids, by the way?
Well, most kids, I'll say. I think that certain age levels, it's not the most important thing in their brain when they're thinking about life.
Right.
And that's okay. That's where they are developmentally. You have to, we all meet people. We all meet people and treat them where they are.
Yeah.
So I'll do, little things like put a hairband on your other wrist, or wear a ring you never wear, or do something that's unique and different, that when they notice it, they say, oh yeah, that crazy lady in Chapel Hill told me I need to make sure I feel my left sit bone when I sit, like just try to, or put sticky notes on their mirrors or their desk or their computer, or just, you have to remind them and just try to help them see it. A lot of times when they see themselves in the mirror and they see what maybe they look like, that might be a motivating factor to look different. And by the way, that's a huge another topic, the whole psychological component to these young bodies that are growing and developing and changing, especially young girls, and then having to wear a brace and just feel like they're different. It can be really challenging. There's a great organization called Curvy Girls, and if you look this up, make sure you Google Curvy Girls Scoliosis. Not just curvy girls, because you might not like what you come up with, but there's a great group. There's a great support group. It's nationwide, and it's for young women and girls. I don't know of a group for boys. Maybe there's one out there. Someone could make a comment and let me know. I can get educated while I'm educating. But anyway, it's a great group.
In terms of an organization or a group, you yourself are in the process of, or already have established, a institute that is more devoted to scoliosis. Can you just briefly talk about that?
So Jean and Susan and I, Jean Massé and Susan Henning and myself, we all work at Advanced PT in Chapel Hill, Advanced Physical Therapy. We have put together a course, a weekend-long continuing education course that we've put on now twice. Last year before COVID, we're still trying to figure out how we're gonna get some information out there in these COVID times. But we teach a lot of PRI in it, in addition to some other components. We don't teach any Stroth because we're not certified to teach Stroth. But the postural restoration knows about it and they're on board and very supportive.
Awesome.
Yes, and so that's our new entity, the Strader Scoliosis Institute. And we are almost ready to publish our website. The website is www.strater, S-T-R-A-T-E-R, scoliosis.com. And it's the Institute's website, and it really is focusing on the clinician. Our focal audience is the clinician who wants to get more information about how to treat scoliosis, and any courses that we might be holding, whether they're live stream or in-person courses. We're working on that schedule right now, but it will also have some educational information in our blog section, or like kind of a question and answer section that we're going to be developing as well. So yeah, it's very exciting times, and this interview couldn't have been more timely. I totally appreciate you reaching out to us to get more information for your listeners
and for me, because I don't know how to respond to it when people ask. I'm like, I don't know how to respond to that question. So that was perfect timing. So Lisa, thank you so much for
You're welcome.
to this interview. Get this information out there.
I don't know that I answered every question that we may have wanted to go over, but I know that my coworkers in part 2 and part 3 are going to talk a lot more about things and maybe offer some more details about certain things. So to your listeners, tune in to the rest of it as well. But again, yeah, Neil, I appreciate you so much, and thank you.
All right.
Thank you so much.
All right. Bye-bye.